అదే RTV యాప్ వార్తల్ని క్షణాల్లో చదివే అవకాశం ఉంటుంది. ఒక న్యూస్ పేపర్, ఒక టెలివిజన్ ఛానల్ మీ చేతుల్లో ఎప్పుడూ ఉంటాయి.
హలో ఆల్, వెల్కమ్ బ్యాక్ టు RTV హెల్త్. నేను మీ కౌసల్య. ఈరోజు ఒక మంచి ఇంటర్వ్యూతో మీ ముందుకు వచ్చేసాను. ఈరోజు మనం అపోలో క్రెడిల్ జూబ్లీ హిల్స్లో ఉన్నాం. ఈరోజు మనతో పాటు ఉన్నారు డాక్టర్ కృష్ణ స్వరూప్ రెడ్డి గారు. ఆయన సీనియర్ కన్సల్టెంట్ ఇన్ పీడియాట్రిక్స్ అండ్ నియోనాటాలజీ. బేసిక్గా మనకి చిన్న పిల్లల్లో చూస్తూ ఉంటాం, పుట్టిన పిల్లల్లో జాండీస్ అని చెప్తూ ఉంటారు. దాన్ని నియోనాటల్ జాండీస్ అని కూడా అంటూ ఉంటారు. బేసిక్గా ఇది ఎందుకు వస్తుంది, దీనికి మెయిన్గా సిమ్టమ్స్ ఏ విధంగా ఉంటాయి, చిన్నపిల్లలు అనగానే చాలా భయపడుతూ ఉంటాం, ట్రీట్మెంట్ ఏ విధంగా తీసుకోవాలనే ఒక ఆలోచన కూడా ఉంటుంది. సో బేసిక్గా ఎలాంటి జాగ్రత్తలు తీసుకోవాలి, ఎలాంటి ట్రీట్మెంట్ తీసుకోవాలి, కంప్లీట్గా నియోనాటల్ జాండీస్ గురించి ఈరోజు ఈ ఇంటర్వ్యూలో మనం తెలుసుకుందాం. ఈరోజు మనతో పాటు డాక్టర్ గారు ఉన్నారు, ఆయనతో మాట్లాడి ఈ విషయాలన్నీ తెలుసుకుందాం. నమస్తే సార్, ఎలా ఉన్నారు?
బాగున్నామండి.
యా సార్, నియోనాటల్ జాండీస్ అంటే ఏంటి? చాలా మందికి ఎలాంటి జాగ్రత్తలు తీసుకోవాలి, ఏంటి, ఎలా వస్తుందో కూడా తెలియదు. సో బేసిక్గా నియోనాటల్ జాండీస్ గురించి చెప్పండి.
నియోనేట్స్ అంటే న్యూ బోర్న్స్, అంటే 0 నుంచి 28 days లోపల ఉండే వాళ్ళని నియోనేట్స్ అంటాం. జాండీస్ అంటే ఇట్స్ yellow discoloration of the skin and the sclera, that is white part of the eye ni sclera అంటాం. దాంట్లో yellowness ఉంటే దాన్ని జాండీస్ అంటాం. ఓకే, this is caused because of increased bilirubin in the blood. That's called hyperbilirubinemia. అంటే బ్లడ్లో బిలిరుబిన్ ఎక్కువ అయితే హైపర్బిలిరుబినియా అంటాము. సో బిలిరుబిన్ ఎందుకు వస్తుంది? మన రెడ్ బ్లడ్ సెల్స్ మన దీంట్లో ఉంటాయి. ఓకే, దే గెట్ డెస్ట్రాయిడ్ ఇన్ ద స్ప్లీన్ అండ్ ద రెడ్ బ్లడ్ సెల్స్ ఆర్ యూజువలీ ఈస్ produced by destruction of red blood cells. Red blood cells usually are destroyed in the spleen and into heme and globin. Heme is again converted into bilirubin and iron. Globin and iron get absorbed, but the bilirubin is bad product which has to be eliminated. So this bilirubin goes into the liver and gets conjugated. The conjugated bilirubin is water soluble, whereas unconjugated bilirubin is not water soluble. It can cause blood-brain barrier, and that can cause kernicterus back to the brain. So cause kernicterus in the brain. So this causes neurological problems in the newborn. That's why we are very worried about the high unconjugated bilirubin in the blood. The bilirubin which is not conjugated is called indirect bilirubin, or as conjugated bilirubin which is in the liver is called direct bilirubin. So unconjugated bilirubin is more dangerous than direct bilirubin.
Okay, so how common it is, sir?
The thing is this very common condition in the newborn. In term babies, that is term babies who are born after 37 weeks of gestation, it is about 60%, whereas preterm babies, the incidence is about 80%.
Oh, okay. So what would be the main symptoms?
The most main symptoms of the jaundice, that is yellowish discoloration of the skin and the sclera. And suppose if the babies are still more, the bilirubin is more in the blood, they can also be lethargic, that is they won't wake up, and they have poor feeding, then also irritability, high pitched cry. If it's not treated, if it's still very severe, then they can go into the bilirubin can cross the blood-brain barrier, then cause kernicterus, which causes neurological damage to the baby.
డయాగ్నోస్ అనేది జనరల్గా మనం జాండీస్లో సిమ్టమ్స్ చూసి చెప్పేసేయచ్చా, లేదంటే ఏదైనా పర్టికులర్ టెస్ట్ ఏదైనా ఉంటుందా?
Basically, first thing is by seeing the baby.
Okay.
Physical examination.
Okay.
And also history from the parents, whether the baby is feeding well, not feeding well, or the baby is lethargic or very sleepy, or very active or not, and also whether what is the mother's blood group and the child's blood groups. We need to know all the history. Then physical examination, when you look at whether the baby is jaundice, that is yellow ga untadi skin, and the sclera ante white part of the eye also becomes yellow, called icterus. Okay, and other thing is That is the physical examination. So we know that the baby has jaundice.
Okay.
Then how do you determine whether baby, how much the level of jaundice is?
Okay.
Then either you can do a transcutaneous bilirubin or a blood test. Transcutaneous bilirubin, you don't need to do any blood test. You can do with a gun, which you can see what the bilirubin level is.
Okay.
The other thing is you can do a blood, okay, and those are the blood tests we can do.
Okay,
So if the bilirubin is very high, then we'll, depending on, we have graphs.
Okay.
It depends on the age of the baby and the whether preterm or full term or how many old is the baby. Depending on it, the graphs will say whether the baby is under the phototherapy level or exchange transfusion level, or you don't need any ట్రీట్మెంట్ అట్ ఆల్.
నియోనాటల్ జాండీస్ వచ్చినప్పుడు సో మనం ఏ విధమైన జాగ్రత్తలు తీసుకోవాలి, ముఖ్యంగా ట్రీట్మెంట్ ఎన్ని రకాలు ఉంటుంది, ఎలాంటి ట్రీట్మెంట్స్ అనేది మనం ఇస్తూ ఉంటాం?
It all depends on the cause of the jaundice.
Okay.
What are the causes of neonatal jaundice? Most common causes are physiological jaundice. Most of the physiological and normal. Basically, every baby gets it.
Yeah.
Okay, that's what I said. 60% of term babies and 80% of preterm babies have jaundice.
Okay.
So physiological jaundice, we don't need to do anything. Most of the babies get jaundice by 24 to 48 hours, and they get the peak in about 3 to 4 days, and then they get better at 7 to 10 days. Whereas the preterm babies take a little bit longer time.
Okay.
And whereas there's the physiological jaundice.
Okay.
So physiological jaundice, they usually get away, we don't need to do anything. So when you have physiological jaundice, we may say, what is pathological jaundice? Suppose if you see the baby gets a jaundice within 24 hours, or if the baby jaundice is raising by 5 milligram per deciliter in a day, or if the baby's jaundice is prolonged more than 2 weeks in term, and more than 3 weeks in preterm, this is called pathological jaundice.
Okay.
There are other causes of jaundice also. One is, other thing is breastfeeding jaundice. Chala mandi mothers, they want to breastfeed, but they don't have enough breast milk, so they persist, and the baby gets dehydrated. The baby becomes very lethargic, and the baby also, because the baby is dehydrated, the concentration of the bilirubin goes up, so there is exaggerated this thing, and so the bilirubin level is high.
Okay.
So that's called breastfeeding jaundice. There's another thing called breast milk jaundice. E jaundice lo breast milk valla there are substances in the breast milk which inhibits the metabolism of the bilirubin. That is
Okay.
conjugation of the bilirubin. So in this cases also the jaundice is prolonged. Okay. The other causes of jaundice like incompatibility of the bloods from the mother and the baby. For example, RH incompatibility. If the mother is RH negative and the baby is RH positive, the baby's red blood cells goes into the mother womb through the placenta. They produce antibodies. Okay. These antibodies come to the baby and acts on the red blood cells and breaks down the red blood cells. So they hemolyze and more bilirubin is produced. So there's the RH incompatibility. Similarly, you can have ABO incompatibilities also, where the mother is O and the baby is A or B or AB. They can also have cross reaction, just like what RH incompatibility does. Here also the baby's antibodies goes into the genes goes into the mother. Mother produces antibodies. It comes to the baby and destroys the red blood cells.
Okay.
That's called incompatibility of the bloods. You can also have other things like any fragility of the red blood cells, or like spherocytosis, elliptocytosis, the red blood cell wall defect, or they can have their enzyme glucose 6-phosphate dehydrogenase deficiency. All these things can also cause breakdown of the blood.
Okay.
RBC, causing increased bilirubin. Sometimes these babies also can have what you call, the mother, when the baby is coming out, they can have a lot of bruising, or could have be cephalomyopathy. There is blood collected in the scalp. This blood gets absorbed, and then more bilirubin is released, and they can also get the jaundice.
Okay.
These are the main causes of the jaundice. So depending on the cause, we need to treat.
పిల్లలకి ఇలా నియోనాటల్ జాండీస్ వచ్చినప్పుడు మదర్ కూడా ఏదైనా డైట్ ఫాలో అవ్వాల్సి ఉంటుందా, లేదంటే తను రెగ్యులర్ రెడ్డి తీసుకోవాలా? ఎందుకంటే మదర్ బ్రెస్ట్ ఫీడ్ ఇస్తుంది కాబట్టి, సో మదర్ కూడా ఇలాంటి డైట్ ఏదైనా ఫాలో అవ్వాల్సి ఉంటుందా నియోనాటల్ జాండీస్ వచ్చినప్పుడు?
మదర్కి బేబీకి ఏమీ ప్రాబ్లం లేదు,
Okay.
బికాస్ మదర్ కెన్ హ్యావ్ నార్మల్ డైట్ అన్లైక్ అడల్ట్స్
Okay.
వేర్ ద ప్రోటీన్ వీ డోంట్ గివ్ ప్రోటీన్ ఫర్ జాండీస్ patient. Here mother can have all the diet.
Okay.
It doesn't cross the pleasant the blood, it doesn't cause in the blood any blood sorry the cardiovascular. Mother can have normal diet.
Okay.
Because it doesn't affect the baby by taking the blood, even though they breastfeed the babies.
Okay.
Okay, so the mother can have normal diet so that the mother can at least feed the baby better, and the mother also can get more milk.
బేసిక్గా నియోనాటల్ జాండీస్ వచ్చినప్పుడు జనరల్ ఊళ్ళల్లో కూడా అలా చెప్తూ ఉంటారు, కొంచెం సన్లో పెడితే పిల్లలకి జాండీస్ తగ్గిపోతుంది అని అంటూ ఉంటారు. ఇది ఎంతవరకు నిజం, లేదంటే వీళ్ళు డాక్టర్ని కన్సల్ట్ అవ్వాలా?
Actually, if you see, first we diagnose phototherapy because of the putting in the light. Okay, but this light alone is not sufficient to reduce bilirubin if necessary. So phototherapy, you can't replace phototherapy for sunlight because it only can be given for a few hours. Okay, and also we don't recommend direct sunlight, it's only indirect sunlight we recommend. Okay.
ఓకే. నియోనాటల్ జాండీస్ని మనం ప్రివెంట్ చేయొచ్చా? ఒకవేళ ప్రివెంట్ చేయొచ్చు అనుకుంటే అది ఎలా ప్రివెంట్ చేయొచ్చు?
Basically, as I told you, most of the sometimes they can have exacerbated physiological jaundice. Anything, as you said, depending on the age, depending on whether the baby is premature or the mature, or the level of bilirubin, we need to give the treatment. The normal treatment is phototherapy.
Okay.
That is putting the baby under the lights. There's the blue light. What it does is it converts the bilirubin, which is in the blood, and makes it easy for the baby to excrete. Okay. So that's how it happens.
Okay.
So that is the major treatment for the neonatal jaundice.
Okay.
There are some conditions where the bilirubin becomes very high. So much that the levels are so high that it might cause kernicterus, means the bilirubin can go into the brain, causing a problem, a neonatal problem, a neurological problem. So in those conditions, what we need to do is we do an exchange transfusion. We take appropriate blood, compatible blood, and replace the blood, baby's blood, with the compatible blood.
Okay.
We take off a little bit of blood of the baby and give some little bit of blood of the baby. We do a exchange transfusion over a couple of hours time, so that all the antibodies which are there and the bilirubin which is there is being removed.
Okay.
Especially this is useful in the babies who have RH incompatibility and ABU incompatibilities.
Okay. So this is about the treatment?
This is further this thing. So some other times we can also give IV immunoglobulins also. That also can cause reduction in the bilirubin.
Okay. So what would be the prevention of neonatal jaundice? Is there any prevention?
I mean, the thing is, there are preventions. Suppose if the mother has RH incompatibility, so the one pregnancy and when the baby is born, before for the next baby, they should give anti-RHD injections. Okay, or if they have abortion also, they have to give. Okay, and also the important thing is to monitor these babies and see whether they go reaching in the what do you call in the phototherapy level or exchange transfusion levels, monitoring the babies continuously. And the other thing what we need to do with these babies are that other important thing is feeding the baby.
Okay.
So we need to feed the baby properly. Suppose if the mother is not getting enough breast milk, they should at least give some formula milk apart from the breast milk, so that the baby doesn't get dehydrated. But the breast milk jaundice also, if the breast milk is causing jaundice, we don't need to stop the breast milk, we need to continue the breast milk.
ఓకే. డెలివరీ అయిన తర్వాత బేబీని డిశ్చార్జ్ చేసిన తర్వాత మీరు ఎలాంటి జాగ్రత్తలు చెప్తూ ఉంటారు పేరెంట్స్కి?
Basically, I mean, most of the babies without treatment also go home.
Okay.
Okay. So we'll tell them to come back and see if the babies are becoming more jaundice, to come back.
ఓకే
Okay. Suppose if the babies are become more jaundice, they need to come back in couple of days time, see where the bilirubin level is, and if there's more, then we need to do some blood tests.
ఓకే
Okay, we can do a transcutaneous bilirubin. If it's high, then we'll do a test. So when you send the baby, we know most of the babies go home after vaginal delivery. Once they go home, we tell them if the baby becomes jaundice, they should come back in a couple of days to see what the bilirubin level is.
Okay.
If the bilirubin level is very high, then we may need to put the baby under phototherapy. And we also know if they have RH incompatibility, and we have also done a Coombs test. If the Coombs is positive, we know that the baby is more prone for this. So we're going to tell them that they will be more, they should come back earlier for follow-up.
Okay.
And we monitor those babies. And continuous feeding is very important during these days.
Okay.
Okay. And if there's a prolonged jaundice, the baby's bilirubin is more than 2 weeks in term babies and more than 3 weeks in preterm babies, or if the stool is white, then they should come back.
ఓకే
Okay. Right.
చూసారు కదా ఇవాల్టి ఇంటర్వ్యూ. ఈ ఇంటర్వ్యూలో మనం నియోనాటల్ జాండిస్ గురించి పూర్తిగా తెలుసుకున్నాం. బేసిక్గా ఎలా కాజెస్ ఉంటుంది, సిమ్టమ్స్ ఏ విధంగా ఉంటాయి, ట్రీట్మెంట్స్, ఎలాంటి జాగ్రత్తలు తీసుకోవాలి, ఇలా అన్ని అంశాలని మనం ఈ ఇంటర్వ్యూలో తెలుసుకుందాం. మళ్ళీ ఇంకొక మంచి ఇంటర్వ్యూతో మీ ముందుంటాను. థ్యాంక్ యూ సో మచ్.
మరిన్ని వీడియోస్ కోసం ఛానల్ ని సబ్స్క్రైబ్ చేయండి, లేటెస్ట్ అప్డేట్స్ కోసం వాట్సాప్ ఛానల్ ని ఫాలో చేయండి, అండ్ లింక్ డిస్క్రిప్షన్ లో ఉంది.